I'd like to ask your permission to use this video for educational purpose and on the internet.
Yes, sir.
Now, this is actually, I believe, second visit after the surgery,
Yes.
correct? And we did a quite big surgery. Let me turn around here.
Yes.
We did a L2 to S1 fusion. You had side bending of the spine. You had quite malaligned spine. And we did this surgery about 4 months ago. Is that correct?
Yes.
Okay. Now, first of all, everything today looks good. The bone actually growing. The way I know the bone is growing is because the white here going across in all levels, just 4 months after surgery, but as well in the back where we call that facet, the bone there are as well growing. So I'm very happy actually. The bone is growing in the back, but after our surgery, we had some problem on the left side. Describe first of all your symptoms in the legs before the surgery and after the surgery.
I had severe, deep ache, and it started on the right side, and I had it for a long time. Sometimes it'd be down in the side, it'd be in the hip, it'd go to the front, and then...
How many years did you have that before the surgery?
Years.
Years, okay.
And then about 8 months before the surgery, it decided to switch to the left leg.
Yeah, okay.
And that seemed worse because the right leg I could explain because you're using the throttle, and I do a lot of driving. But when it went to the left leg, it seemed like a worse pain.
1 to 10, what number did you
it was
give
8.
8.
And it was hard to find anything that gave me relief.
And then we did the surgery 4 months ago.
You did.
First of all, how was, after the surgery, the pain that you just described in your legs? How was that?
I didn't have that pain.
So that pain was gone right after the surgery?
That was gone, and I didn't have back pain.
The back pain was gone too?
It was fabulous.
But you had a new leg pain?
But I had a left leg pain. But it was achy, and I can't say that it was really awful. It was just restless. I couldn't be still. It was frustrating that I couldn't lift my left foot up.
Yeah, and if you remember, we talked about that you have to push the nerves to the side to get in.
Right.
And that irritated some of the nerve, but as well you had a weakness on the left foot.
Right.
And but that actually is getting better. You had as well numbness going to the top of the foot. How is that numbness now?
I still have some numbness. It's going to take time.
Okay, but comparing to 4 months ago or right after the surgery,
it's better.
It's better.
It's better, and my foot is better. It comes up.
Yes, and that is one of the things that we noticed for some patients, especially with big surgeries, that nerve can be irritated right after the surgery.
Right.
And about that, usually it starts getting better about 4 to 8 weeks after the surgery, but then keep getting better. So we are just 4 months out. We have a long way to go, but everything is on track. I'm very happy. Bone is growing. What's amazing is that after this big surgery, bone is in all levels is growing, but as well symptoms in the legs are getting better. How is your daily activity?
It's just fine. I still work. I go into work once a week, sometimes twice.
Okay.
And I wear my little bone stem to work.
Okay.
And I wear it at work, and
it's
they look
working.
and they say, "What does that do?" And clearly, it's nice to know that it's really doing what it's supposed to do.
It is.
So I'm at 96% compliant with it.
Excellent.
The only days I missed were when I was really sick, and I couldn't wear it then.
That's fine.
But otherwise, I make sure that I wear it, and I do my 4 hours every day.
Well, I'm very happy with the improvement so far. Your symptoms are all going the right direction. And, you know, that surgery, it took us a little more than 2 hours to do that surgery. And our blood loss, I'm just looking at that, was very little actually. And you stayed, because of your problem with the foot, you stayed 3 nights in the hospital. But that was a 4-level fusion. And we put 4 cages, 10 screws, 2 big rods there. So overall, I'm very happy. I'm very satisfied.
I'm happy.
Excellent. Well, thank you so much for the interview. We are going to just go with the time. You know, I got 1 testimonial. With the time, we are going to get more testimonials and follow up how you are getting better. Okay. Because I think for many of my patients as well, it's important to know, first of all, not everybody gets those side effects. But even if you get it, we want to show them how it gets better.
Right.
Okay? Well, thank you so much.
It takes time.
Yes.
It takes patience.
Exactly. That's why they call you patient.
Yes.
Because it's hard to be patient.
And do your PT.
Exactly. Well, thank you so much.